Okay, so have you heard about this crazy story with the UnitedHealthcare CEO,
Yeah, I saw something about it online. What was his name again?
Brian Thompson?
Yeah, right.
Brian Thompson, and he was murdered. But get this,
Wow.
people are like supporting the suspect. It's really bizarre.
Really? Like, are they condoning the violence?
No, not exactly, but it's almost like they're cheering for him, like they're glad it happened.
Huh, that's disturbing. What's the suspect's name?
Luigi Mangione, he's in custody, but the public reaction is just so strange, you know?
Oh, no.
Like we said, we always like to take a deep dive into these stories, and maybe Rep. Alexandria Ocasio-Cortez can help us unpack this a little bit.
Oh, really? What did she say?
Well, she gave an interview to CBS News.
Oh, yeah, I think I saw that one.
Yeah. And she condemned the killing, obviously, but she also talked about, how much Americans are frustrated with healthcare.
That's
She's pretty blunt about it. She said, quote, "People interpret and feel and experience denied claims as an act of violence against them," end quote.
Wow. So is she saying that the healthcare system is responsible for this, for violence?
I don't think she's blaming the healthcare system for the murder itself.
Okay.
But she's definitely trying to show us that people's emotions are really intense when they're dealing with healthcare stuff.
Right.
Like for them, denied claims or, ridiculous costs or just not being able to get healthcare at all. It's like a personal attack almost.
Yeah, I see what you mean. It's like that concept of structural violence. Have you heard of that?
I think so. Remind me.
Well, it's basically when a system itself is hurting people,
Oh, right.
even if no one specific person is doing anything wrong. You know?
Yeah.
Like there was a study in The Lancet in 2019, I think it was,
Mm-hmm.
that said that like over 100,000 deaths in the U.S. every year
Wow.
are because people don't have health insurance.
Oh, my gosh.
Yeah, so it's like the system itself is contributing to those deaths in a way.
That is really disturbing, and it makes you think that maybe, with that many people dying because they can't get health care. It's not that shocking that some people might feel desperate enough to do something drastic.
Yeah, that's a good point. It's really like, it doesn't excuse the violence, obviously,
Of course.
but it can maybe help us understand why people are so angry.
Absolutely. And AOC even shared her own story about health care before she got to Congress.
Okay.
Back when she didn't have health insurance, she had to go to one of those free clinics to get an affordable blood test.
Oh, wow. And this was like before she was a congresswoman.
Yeah, while she was actually running for Congress. Can you believe that?
Really?
And while she was sitting in the clinic, there were people outside campaigning for her, holding up signs with her name on them.
That's crazy. What a contrast.
I know, right? It's like a perfect example of how out of touch some politicians are with the struggles that everyday Americans face.
For sure. I bet that experience really shaped her perspective on healthcare.
Yeah, and it makes her message even more powerful because it's clear that she's been there. She understands what it's like to struggle with this system.
Yeah. And I think she's trying to connect that personal experience with this bigger issue of inequality. It's not just about healthcare. It's about a system that seems rigged against certain people.
That's a good point. So we're seeing this public frustration with healthcare, this feeling that it's not working for them.
Right.
But does that, I want to be very careful here. So does that justify violence in any way?
Well, no, definitely not.
All right.
I mean, it's important to separate the act of violence from the issues that are behind it.
Okay.
Just because you can understand why someone might be angry doesn't mean that they're allowed to hurt other people.
Yeah, but we're not saying that violence is okay. We're just trying to see where these intense feelings are coming from.
Right.
Like there's real pain and frustration driving these extreme reactions. That's what we need to understand.
Exactly. And that's why we need to look deeper. How do we address these systemic issues in a way that doesn't involve hurting anyone?
Right. And speaking of unanswered questions, let's talk about the suspect, in this case, Luigi Mangione.
Okay.
He's pleaded not guilty, and so far there's no clear evidence linking him to the murder. It seems like there's a lot more to this story.
Yeah, you're right. There's definitely more to uncover here. And I think as we learn more about this case, we should remember this bigger picture, about the healthcare system and how people are feeling.
It's a reminder that even shocking events like this are connected to bigger forces in society.
Exactly. And understanding those forces is crucial if we want to really grasp what happened here and move towards a more just society.
You said just now, it's interesting. Some people are comparing this case to like historical examples of social unrest.
Oh, really? That's interesting. What kind of examples?
Well, like the bread riots back in the 18th century, when people were so hungry and poor that they started rioting.
Oh, yeah. I remember reading about that. It's a really good comparison. It shows that When people feel like their basic needs aren't being met and they don't see any other way out, they might do extreme things.
Exactly. And it makes you wonder if we're seeing something similar today with healthcare access being the essential need that people are fighting for.
That's a really thought-provoking idea, and it brings up a big question. What can we learn from history to prevent this from happening over and over again?
Right, because if we understand the past, maybe we can find solutions for the present. And, speaking of solutions, it's important to point out that AOC isn't just pointing fingers. She's also advocating for change.
Right. She's not just saying the system's broken. She's actually trying to fix it.
Exactly. She's pushing for systemic change. She wants to transform the way we think about healthcare in this country.
So it's not just about making healthcare cheaper or easier to get. It's about a deeper, more fundamental change.
Yeah, like a total overhaul of the system.
That's right. She's arguing that we need to move away from a system that prioritizes profit over people and towards one that truly values health and well-being for everyone.
That sounds like a pretty radical idea, especially in today's political climate.
It definitely is, but it's a conversation we need to have.
Yeah.
How can we create a healthcare system that is fair and just for everyone?
Right. How can we make sure that everyone has access to the care they need, no matter how much money they make or where they come from?
Well, those are tough questions, but they're the questions we need to be asking.
And maybe this case with all its complexity and, unsettling aspects can be what finally gets people talking about these issues.
It's definitely a story that's making people think and question the status quo.
And as we learn more about it, I think it's crucial to keep those bigger questions in mind, because this isn't just about one CEO or one suspect. It's about the state of our healthcare system and the deep frustrations that so many Americans are feeling.
It's a reminder that individual actions, even the most shocking ones, are often connected to much larger societal issues.
And if we want to understand one, we need to understand the other.
Exactly. And maybe, just maybe, by exploring those deeper issues, we can find a path towards a more just and equitable future for everyone.
Yeah, it really does make you think, about how connected everything is. Like, how these big issues we don't always think about can actually drive people to do things.
Yeah, and it raises a really important question, I think. Like, are we as a society doing enough to address these problems? Like, if people are feeling this level of desperation about healthcare, what can we do to, to help them to make sure they feel like they have options?
Right. That's the big question, isn't it? It's easy to just focus on the shock of, of a crime like this, but we need to use that energy to try to actually make things better.
So where do we even begin with that? I mean, these problems feel so huge, so systemic,
I think one place to start is by trying to understand the different perspectives that are out there. Like, you have people who believe, like AOC, that the whole system is just fundamentally broken and needs a complete reset. Right. Like, we need to scrap the whole profit-driven healthcare system and start over with something that focuses on universal care for everyone.
Exactly. And then you have others who say, the system's not that bad. It just needs some adjustments here and there to make it more efficient and affordable.
Right. Like maybe reducing administrative costs or negotiating lower drug prices, something like that.
Yeah, things like that. So it's not a simple issue. There's a whole range of opinions on how to fix this.
For sure. But even with all those different opinions, one thing's clear: we can't just ignore the problem.
Absolutely. If we don't address these issues, all this frustration and anger is just going to keep building, and who knows what that could lead to.
Okay, so we need to have these conversations. We need to listen to each other, and we need to actually take action. But what about the individual person? What can someone listening to this right now do to make a difference?
That's a good question. And I think the first step is really just staying informed. Keep learning about these issues and having thoughtful conversations about them.
So don't just scroll past the headlines. Actually read the articles, listen to podcasts, really try to understand how the healthcare system works.
Exactly. And once you have that knowledge, you can start thinking about how you want to get involved.
Yeah.
It could be volunteering at a local clinic, or donating to an organization that's working to improve healthcare access, or even just talking to your friends and family about these issues.
Right. It doesn't have to be some big grand gesture. It can be small actions, but consistent effort over time.
Exactly. And remember that change doesn't happen overnight. It's a long process. It takes patience and persistence.
So don't give up if you don't see results immediately. Just keep pushing, keep advocating, keep having those conversations.
Absolutely. And another thing you can do is support politicians and organizations that align with your values, like vote for candidates who are committed to healthcare reform, donate to groups that are working to expand access to care, make your voice heard.
So be an active citizen, not just a passive observer, get involved.
Right, and that's where real change starts to happen. Now, let's come back to this case for a minute. We've been talking a lot about AOC's perspective, but I'm curious to hear your thoughts on this public sympathy for the suspect.
Yeah, that's definitely something I've been thinking about, too. It's such a strange reaction to a violent crime. You don't usually see people rallying behind someone accused of murder.
Right, and I think it really shows you how deep this frustration and anger towards the healthcare system runs. It's almost like people are projecting their own experiences onto this case. They're seeing the suspect as a symbol of their own struggles.
Yeah, it's like they're saying, I understand why he did it, even if I don't agree with it,
Exactly, and that's a dangerous line to tread because it could lead to people thinking that violence is an okay response to problems in society.
Right, and that's why it's so important to have these nuanced conversations to acknowledge the complexity of the situation without saying that violence is okay.
Absolutely. And I think it's worth noting that, this public sympathy isn't necessarily for the suspect himself. It's more about what he represents.
What do you mean by that?
Well, to some people, he's become a symbol of resistance against a system that they see as unjust and uncaring.
So it's not that they condone murder, it's that they're expressing their own frustration with the healthcare system.
Exactly. And I think that's an important distinction to make. It's not about celebrating violence. It's about feeling so powerless and desperate that they're looking for any sign of hope, even if it comes from a tragic and misguided act.
It's like they're saying someone finally did something, even if it was the wrong thing.
Right. And that's a really disturbing thought because it suggests that the system has failed to give people peaceful ways to address their problems.
Well, if we want to prevent these kinds of things from happening again, we need to create a system that's more responsive to people's needs, more accountable to the public and more focused on finding solutions instead of just making things worse.
You're absolutely right. And that brings us back to that question of what we can do both individually and as a society to make that better system happen.
Right, because ultimately this isn't just about one case or one suspect. It's about the kind of society we want to live in.
And it's about recognizing that we all have a role to play in shaping that society, in creating a world where everyone feels heard and valued and cared for.
And speaking of caring, let's not forget about the victims in this case. Brian Thompson, the CEO, he lost his life, and his family is left to grieve.
That's right. It's easy to get caught up in the political and social side of this case. But we need to remember that there are real people who are hurting people whose lives have been changed forever by this.
Absolutely. And while we're exploring these complex issues, we should keep those victims in our thoughts and remember the human cost of this tragedy.
And as we learn more about this case and as the legal process plays out, I think it's important to keep in mind this bigger context we've been talking about.
Right. This isn't just a courtroom drama. It's a reflection of these deeper problems in society that we need to address.
Oh, and it's a reminder that true justice isn't just about punishing people who do wrong. It's about fixing the root causes of injustice and creating a system that works for everyone.
So as we move forward, let's keep asking those tough questions. Let's keep pushing for solutions, and let's keep trying to build a society where everyone feels safe and healthy and valued.
Because that's what's really at stake here.
I don't know about you, but I'm still kind of reeling from all this. You start with this shocking murder, and pretty soon you're thinking about all these big problems in society and what we can do to fix them.
Yeah, it's definitely a case that makes you look beyond the headlines, and see those deeper connections that are shaping our world.
And it really hits home that even though this specific case feels like this one isolated thing, it's actually tied to so much else that's happening right now.
Absolutely.
Yeah.
Think about the rising cost of living, the gap between the rich and the poor, all the political division we're seeing. It all adds up to this feeling of unease, like things are spinning out of control.
And when people feel like they don't have any control, like their voice doesn't matter and nothing they do can change things,
Right.
That can create a sense of desperation, like they have nothing left to lose.
That's a really important point because that desperation, it can show up in different ways. For some people, it might be like withdrawing from society, just not caring anymore.
Yeah.
But for others, it might be lashing out, expressing their frustration through anger or even violence.
It's a pressure cooker, right? The pressure keeps building and then eventually something's got to give.
That's a great analogy, and it really highlights the need for healthy outlets for that pressure, ways to channel those feelings into something constructive.
So how do we do that? How do we as individuals and as a society prevent that pressure cooker from blowing up?
Well, on a personal level, I think it's important to find ways to deal with stress and anxiety in healthy ways. Things like exercise or meditation or spending time in nature, connecting with loved ones, or even seeking professional help if you need it.
So basically, taking care of your mental health is really crucial, especially when things are tough.
Absolutely, because if you're not taking care of yourself, it's much harder to show up for others and to do the work of, trying to make the world a better place.
Right. And what about on a societal level? How do we create systems that are more fair and just that give people that sense of security and opportunity?
Well, that's about investing in things like affordable health care and quality education and job training programs.
Okay.
And making sure there's a safety net for people who are struggling.
So it's about building a society where everyone has a chance to thrive, not just survive.
Exactly. And it's about listening to the people who are being marginalized and unheard.
Yeah.
Really trying to understand their struggles and working together to find solutions.
All this talk about solutions reminds me of that quote from AOC about how denied claims can feel like an act of violence.
Yeah, that's a powerful way to put it, isn't it?
Yeah,
it really shows how much these systemic issues can hurt people on a personal level.
And it makes me think, if we're going to have these big conversations about healthcare reform, how do we make sure those conversations are actually productive? That they actually lead to change?
That's a great question. I think it starts with being willing to listen to different perspectives, even if you don't agree with them.
Yeah.
Really trying to understand where people are coming from.
So no yelling, no name calling, just a real effort to see things from each other's point of view.
Exactly. And it's also important to be specific. Instead of just saying the healthcare system is broken, let's talk about the actual problems and what we can do to fix them.
Right. So instead of just complaining, let's use that energy to have a real discussion and brainstorm solutions.
Exactly. And we need to be persistent. Change doesn't happen overnight. It takes time and effort and a willingness to keep pushing, even when it feels like nothing's changing.
It's about playing the long game, right? Knowing that even small steps can add up to big changes eventually.
Exactly. And it's about remembering that we're all in this together. We all have a responsibility to create a society that's just and equitable and sustainable.
So for everyone listening out there, this case might seem like just another news story, something that'll fade away pretty quickly, but I hope we've shown you that it's actually much bigger than that.
It's a reflection of the problems we're facing as a society.
Yep.
The fears we have, the systems that aren't working, and the choices we make every day that shape our future.
It's a story that forces us to ask hard questions, to confront uncomfortable truths, and to really grapple with how complex our world is.
But it's also a story that gives us hope, because it reminds us that we have the power to change things, to create a better world for ourselves and for future generations.
So as you go about your day, let this case be a reminder to stay engaged and stay informed and keep fighting for the kind of world you want to live in.
Because even when things feel chaotic and uncertain, there's always hope for a better future. And that hope starts with each and every one of us.